Well, thank you for having me. Thank you for having us come down and talk with you. You've got a beautiful center here. Again, my name is Douglas Ross. I'm the director of the emergency department at St. Joseph's. And we really wanted, St. Joseph's is really taking a lead in this part of the state of trying to get information out to the public about the H1N1 virus, or as everyone really knows it, the swine flu. So we wanted to really talk to everybody. We have seen in our clinics here, the clinic, in our emergency rooms, in our doctor's offices across Hot Springs and Hot Springs Village, we have seen an explosion of the number of patients presenting to the clinics. I'll tell you a little bit about where this all started. The H1N1 flu virus started in a little village in Mexico in the spring of 2009, this spring. It spread very rapidly and actually caused several deaths. And as they were investigating that virus, they found that the genetic makeup of this virus looked very similar to a known pig virus that passed from pig to pig to pig. It was well known that there was flu viruses that spread among animals. And actually the farmers in this community knew about this virus. They knew to give in vaccinations to their pigs. And these two viruses looked awful the same. So that's how the moniker of the swine flu came about. But that actually was kind of misleading. This virus that is affecting people does not come from pigs. There's been no transmission of any virus from a pig to a person. The only reason that's called the swine flu is because these two viruses look the same under the microscope. So that's really been an injustice to the pork industry in this country and around the world as pork prices dropped. Actually in Egypt, they slaughtered hundreds of thousands of pigs out of the kind of the scare and the hysteria that's going on. And all of us as Razorback fans, we're kind of used to being on the butt end of pig jokes, so I think we all know how some of those pigs felt. But certainly that's kind of where the name came from. But again, this is very different than the avian flu, which you heard about a few years ago, that was in Asia, caused some deaths. That did spread directly from the birds to people. The swine flu is not that way. This is not coming from pigs, okay? This is spread from person to person. The seasonal influenza, there are certain groups of people that are more prone to severe complications, to actually even death. With the seasonal influenza, people over the age of 65, children under the age of 5, especially under the age of 2, pregnant women, people who have underlying chronic medical conditions like diabetes, congestive heart failure. These groups of people are more at risk for complications from the seasonal influenza. And we've seen some similarities between the H1N1 virus and the seasonal flu in that regard, but also some significant differences. With the H1N1 virus, certainly children under the age of 5, again, especially under the age of 2, pregnant women, folks with long-term medical conditions. But for some reason, people over the age of 65 have been less affected by this virus. And there's some different theories out there as to why that's happening. Some of the theories are that there's maybe been a strain that's been somewhat similar to this, a strain of this kind of virus years ago, and quite a long time ago, and that's why people over the age of 65 have actually been exposed to this and actually have some memory, some immunity to it that the younger folks don't have. A pandemic, basically all it tells us is that this flu virus has spread across the country and spread to every country of the world. A pandemic is defined by how far this virus has spread, how severe and how vast it has spread around the globe. A pandemic has nothing to do with the severity of the illness that has spread, only how far it's spread. And if you look across the world, and certainly across the United States, at the data on how fast this has spread, but how few complications there have been, this influenza virus, the H1N1, is actually less dangerous than the seasonal flu. But again, if you look at the numbers, I know we're in a pandemic. I know that this virus has spread across the world. But if you look at it, it is much more mild than even the seasonal influenza we see every year. And I don't think that message has gotten out, and that's where we're really trying to take a lead role in getting that message out to everybody. So, if you get the flu, what should you do? Certainly, there's been some changes in this recommendation as well. If you're in a high-risk group, greater than 65, less than 5 years old, again, pregnant women, underlying chronic medical conditions, we recommend that you go see your doctor. That they can actually put you on some new medicine called Tamiflu or Relenza. There's different medicines out there, and that can actually decrease the duration of the illness and make the symptoms a little bit more tolerable for a lot of people. But if you're young, otherwise healthy, if you get the flu, the seasonal flu, or even the H1N1 virus, we're actually recommending people to stay home. That's actually a big change, is we're just recommending symptomatic therapy, okay? Tylenol, ibuprofen, bring your fever down. Make sure you stay well hydrated and drink lots of fluids. Dehydration is a big killer after influenza. So you do that for a couple days, and certainly if you're not getting any better or you feel there's something wrong, then we go see your doctor. But from a public health perspective and trying to curtail the spread of this virus, if you're healthy, we're recommending you just stay home instead of going out into the clinics, going out into the community where you can potentially spread this virus even more. Okay? So if you're in one of those high-risk groups, we certainly recommend you see your doctor. But if you're not, we recommend you just be patient. We try to have everybody just relax a little bit and take Tylenol, ibuprofen, lots of fluids, lots of rest, some of the good old-fashioned things we've always done. And for the most part, with the H1N1 virus, that's all it takes. People are sometimes better in 2 to 3 days. They've had a little low-grade fever, they stay home, they rest, they're back to work in 2 or 3 days, and they're feeling fine.